Yes, thank you very much, and thanks for inviting me. It's a great honor. And to be honest, I've forgotten to tell my wife that I have this presentation today, and so she was a little bit angry, but I think she has calmed down now in between, and everything is fine. So if you hear me, everything is fine. You see the presentation, very good. So mostly I'm working on muscle physiology, molecular biology of muscle, but somehow I got in the field of VLMX testing and science about VLMX. And to be honest, I worked with Sebastian from Inside many years ago with elite professional cyclists. So I had pretty much of experience with testing by myself and experience the difference in lactate accumulation rates in between athletes. For example, world-class cyclists under the first 10 places on in the Tour de France, for example, but I also worked together with Oliver Heine from the Olympiastützpunkt in Köln. So I got a pretty much insight about what's going on concerning VLMX between different athletes, for example. And I'm not presenting the very fancy things with mathematical modeling and so on. And I do not want to discuss about different nomenclatures or so. I just want to talk a little bit about some findings we recently made in at the University of Hildesheim, where I have a small group working on that issues, and also give you some insights about what the VLMX or maximum blood lactate accumulation looks like in elite athletes, for example. So that's what we are talking about. And I'm sorry that I could not join you from the very beginning. So I do not really know what you have heard today, but I'm pretty sure that many issues here concerning the biochemistry and so on have been addressed, and so I will not go into the deepest detail about that. But just to be sure what we are talking about, we assume that VLMX, for example, is something which derives from the glucose, from breaking down glucose to pyruvate or lactate, which then accumulates. We can collect blood samples from the earlobe, measure the lactate levels in the blood. Currently, we do that after sprint tests. Various issues are there discussed about how long such a test should be. We come later also a little bit on that topic, speak about that topic. And then lactate can be taken up, or pyruvate, via the oxidative metabolism in the mitochondria. And this here is assumed to be a measure of the lactate accumulation rate or maximum glycolytic rate. So there are various discussions about that, and we will not discuss that in this presentation. But what we use mostly is this formula here. So we take a maximum level of lactate determined after exercise or the sprint. We determine a resting lactate level, and then we divide it in the numerator by the entire exercise time or sprint time subtracted by an electric time of around 2.8 to 3.5 seconds or so. And also here are many, many discussions going on. So nobody really knows what is the creatine phosphate level in muscle. It's difficult to determine, and it is not clearly shown whether this amount changes over a season in endurance trained athletes, for example. So many things to do in sports science to unravel the mysteries of lactic time and everything what is related to VLMX determination. So basically, we do then also a mixture of testing between glycolytic and oxidative metabolism. This is then here lactate curve testing, for example. So gradual tests, and after every stage, you know all that. We collect blood from the earlobe, and then we determine these nice curves. And this helps to differentiate between athletes somehow, and also differentiate between different time points in the season, for example, to determine how has been or how much has the athlete improved. Or we do the maximum oxygen uptake testing. So it's just purely oxidative, but this is not true, because if we measure then at the end of such a ramp test lactate, we see that it is also elevated. So the difficulty about testing one component is that the other components are always time-like co-activated to some extent. And this is something we are all aware of, and we have to unravel or to determine things, how we can improve that we measure the pure glycolytic rate, for example. So how relevant is VLMX for exercise performance? We all want to know that. There are many mathematical modeling and simulations that show that or anticipate or calculate that a higher VLMX, for example, contributes to an earlier rise in the lactate curve, because during every stage we have a little bit higher activation of the glycolysis, and this contributes then to a earlier occurrence of the crossing point where the synthesis and the oxidation of lactate is equalized. So to make it short, a high VLMX shifts the curve to the left, very likely, and a high VLMX shifts the curve to the right, very likely, under the assumption that the oxygen uptake, the maximum oxygen uptake, is the same. So if we look under practical situations and we determine oxygen uptake and VLMX, for example, in athletes, we do not see athletes with the very same VO2 max. This is hard to find, and with a very difficult, different VLMX. So this is one of the practical difficulties we have. But VLMX somehow affects the lactate curve. We can remember that. So the problem is that if we look in the practical situation, for example, we have here two Olympic boxers from the German boxing team. I think the left one is around 80 kilogram and the right one is 110, so the heavyweight boxer. And what we see is that we see two curves. One was determined in June, is the blue curve, and one in October, it's the green curve. That really nothing happens concerning the anaerobic threshold. In some cases, also the VO2 max is not really improving, not significantly. Here it is a little bit increased, but the threshold does not change. So the thing is, these lactate thresholds and VO2 max levels do not always help to differentiate between athletes and also training-induced improvements. So this is the reason why we likely all believe that VLMX might help us to have a new parameter which is able to further differentiate between different athlete types and different aspects of energy metabolism within one single athlete. But for me is the question, how high is the variability of VLMX or maximum blood lactate accumulation? Sometimes I speak about MBLA today because we did not measure VLMX or construct VLMX, for example, in boxers, due to one very good reason. And there are not very much data shown about the variability of VLMX between different athlete types. And also, as I heard the discussions before, not between males and females. So this is something we really should pursue to get more data on that. And then I would like to focus a little bit on methodological issues. We published a very nice study that showed that there are some issues that we definitely have to consider when we want to detect VLMX. And the last question for me, which is important, which I want to a little bit address, is how does VLMX influence sport-specific performance? This is something which is, in my opinion, these are key questions for us in VLMX testing. So I'm coming a little bit from the basics side. So what does it mean? What is it all about? And for what is it useful to test it? Okay, so here we have two examples of anaerobic glycolytic performance testing. On the right side, you see here someone sitting on a rowing ergometer. We do then some cases, the anaerobic testing, a 15-second sprint test on a rowing ergometer in Hamburg. And on the left side, we see a picture from the boxing gym in Heidelberg at the Olympic Training Center, where we constructed a test for boxers to estimate the glycolytic capacities or abilities, from these athletes. And I'll show you later some nice data how these guys are different in their abilities to produce lactate. So specific requirements and general requirements for such a test, I'm sure that you heard all of that and discussed of that today, is the activation of glycolysis. It should be maximal. We do not want to activate oxidative metabolism to a high amount. We want to ensure that sufficient muscle mass is activated, but we also want to ensure that it is somehow specific for the discipline. So we do not want to have a rower in front of a sandbag or vice versa, and a cyclist sprinting on a track and field a space where you can do a running sprint. So this is not specific for the discipline, and this creates, and to some degree, also a little bit of problems. So this is what we're doing under practical situations, and also we work together with the German track and field team with the 400-meter sprinters, for example, and we did that some tests on a track and field space where we can do that optimally. And I'll show you some data about that in a few slides. But what we recognize is that in some cases, after a warm-up, for example, which is definitely useful or necessary to prepare athletes for a sprint test, for example, and if we do not carefully consider the restoring of the blood lactate levels to an equal amount of below 1.5 millimoles, for example, we have some athletes there that stand there with a resting lactate, totally fit, able to perform, ready to sprint with about 6 millimole. And we asked us, what is the problem here? For example, if we produce 10 millimoles lactate and we have a baseline level of 6 millimoles, are there coming out 60 millimoles then later, or is it reduced? So this is critical, because if we see here our calculation or our formula we always use, so it might have a significant influence on the level of VLMX that is determined. So what we have done is we created an exercise regimen with 5 different variations in methodology of VLMX testing. The first was the baseline test with a lactate level under resting situations below 1.5 millimoles. And then we can see clearly that after the sprint test of 15 seconds on a running track, we see a significant increase in lactate levels. So this is what's all about in our area of research. And if we do that with increased resting lactate levels, so the same warm-up, but a reduced time for the recurring of the lactate levels to get to baseline levels, for example, and we let these guys start, then we also increase maximum blood lactate accumulation a little bit more than after the initial test. But the difference here, so the difference between resting lactate and maximal blood lactate accumulation is reduced. And the question is, what is the effect? Of course, if we have a similar exercise time or the same exercise time, so VLMX is then reduced. Not because there's lesser lactate buildup, but only because we have this methodological error here. If we let the athletes start with empty glycogen stores and a low-carb nutrition, for example, the resting lactate levels are pretty similar, but indeed there's coming less lactate out. There was less lactate produced, maybe due to limited glycogen stores or whatever, or maybe there's a repression of the glycolytic enzymes, which we could not measure in this approach, but this was pretty significant. What is not so a problem is if you have a high carb diet and full glycogen stores, this does not make a critical difference. And also if you apply acutely apple juice or Coke or Sprite, a glucose-containing beverage, for example, you also do not significantly change the levels of lactate afterwards. So it's pretty comparable to the baseline situation. So only these two methodological aspects are very important, obviously. That our resting lactate levels is almost perfect, below 1.5. And we should avoid to have a low-carb diet, because in the literature it has been shown that if you eat low carb, if you have a low carb nutrition, you also reduce the glycolytic enzymes. So this might be a critical issue if we have a huge mass of athletes and we are doing a testing procedure with them and we do not really know how they did behave in the days before. Now, concerning the acute administration of glucose-containing beverages, for example, it is the case that in some cases you have a significant increase in lactate levels also after the sprinting here. And in some cases they do not respond. Maybe there's something individual with insulin or something going on there. So we cannot say it is okay if you administer Coke before the VLMX test. Better be careful, and it is the best thing to have normal nutrition, and at least 1 hour before the start, do not consume carbohydrate or glucose containing beverages. So this was a simple study and very nice. We have shown that the methodological part of the resting lactate is obviously very, very important. And it is a critical thing because in some cases, if you are working with athletes, you do not have the time to check for every sample. And then afterwards, and if you do that over a period of time, 3 times a year or 4 times a year, and then you have a measurement error and you anticipate that there is a reduction in VLMX, but there is no reduction at all. It's just a methodological issue. Okay, then let's switch to the variability part. So what can we expect in different athletes? And this bar here shows you the VLMX determined in 2024 of elite German male and female rowers. So the orange bars here are the females, the blue bars are the males, and here between 0.3 and 0.5, there we have the huge mass of all the subjects we have tested there in Hamburg. And so it's pretty moderate to low. I'm very sorry. It's a pretty moderate to low VLMAX we observe here in these rowers because they have a very high training volume. These are endurance athletes, although their specific discipline is only taken about 6.6 minutes to 7.5 minutes or so. And these guys here, you see here, these were all taking part in the Olympic Games. So in Paris, and we see that they all are somehow between 0.3 and 0.5. We have very, very few subjects above 0.6, and we have also very few subjects below 0.2. So there's maybe the optimal frame here for the glycolytic capacity or the glycolytic performance of these athletes here. So this is just good to know that this is what we observe very consistently in these athletes. And if we compare to these rowers here, the track and field runners, for example, we see here that after a 100-meter sprint, for example, where the subjects have a different time necessary to cover that distance. We have also here a mixture between female and male subjects. They have a way higher VLMX than the rowers, for example. So the lowest VLMX was 0.8 by a female, and the highest VLMX was 1.4 by a young male. So this was not the absolute elite, but it was the second to third row of the German athletes, and these were 400-meter runners, not 100 meters, not pure sprinters. So we can anticipate that there might be coming out a bit more of lactate in the elite 100-meter sprinters. So, but obviously a crucial difference between rowers and track and field athletes here. And also we have females here with 1.1 lactate accumulation rate, and also a little bit higher than some males. So the question about sex-specific or gender-specific aspects in this context is very difficult because we have to consider then also the active muscle mass and everything what is in the muscle, which we likely do not focus here today because of time restrictions. But the thing is, we have here a range That is 1.7-fold difference between the athletes. And this is very variable, but the thing is, it does not really show a very nice correlation to the sprinting time, for example. So we have with VLA-max here in these athletes not a critical determinant, as obvious, of course not, because we need force and all the other strength capacities for sprinting. So, but VLA-max is something which is obviously very high in these sprinters, but it does not really good correlate to the sprinting time, for example. And now we switch to the boxers. This is the team Germany. It was the maximum blood lactate accumulation was determined in the training camp in Turkey in March 2023. And we see here some from left to right, the data sorted from the lowest maximum blood lactate accumulation to the highest. And the interesting thing is here we have red females and blue males, that there are some crucial differences between athletes. And this is something we really can see when we look at the fighting process itself, about the speed of contractions, the agility of the athlete, and the possibility of the athlete to, or the ability of the athlete to engage in very hard and quick responsive contractions during the fighting process. And here, for example, this male produces a very low amount of lactate after this 30 seconds sandbag test, compared to a female, which is way quicker in the fighting behavior and much more rapid in her actions, but weighing the same. So both athletes, the female and the male, weigh around 80 kilograms. And the muscle mass here is a little bit higher in this male than in the female. So obviously, the muscle mass itself is also not a very critical determinant of the maximum accumulated blood lactate in some of these subjects. But if we look at MBLA over between the athletes, and over time, we see that a maximum accumulated lactate, or also VLA-max, however we would like to call it, is very different between athletes. And the most important thing, I show you later some data about that, it is obviously very stable. So the thing is, we have a huge variability between the athletes. It's approximately threefold difference in some cases. And when we compare that to the anaerobic threshold, for example, or VO2 max, there's no such thing that there's one boxer with 4 meters per second at the threshold and the other boxer with 8 meters per second. So it's much more narrow. So the differentiation of the athletic performance between the athletes, and if we look at anaerobic threshold and VO2 max, for example. So this is a really differentiating parameter here, VLA-max. And I think it's good for sports science that sports science itself is having a look for this parameter. So for me, the further questions I would like to address, maybe with some of you, is to have a detailed look into the muscle later. This is very important because we look always at parameters, VO2 max and VLA-max and threshold and what else. But the thing is, it's a biological thing. So lactate has to be produced by enzymes in muscle fibers. It has to be released from the muscle to the bloodstream, for example. We need lactate transporter from that. We have the bicarbonate system in the blood. So all these tissue structures and elements are very important for creating that what we measure at the earlobe. And this is the thing I really want to pursue, to have a more detailed look in the muscle and see what's going on. Because we always say something, okay, he might have or she might have more fast muscle fibers, but we cannot determine it very easily. Of course, there is for sure a correlation, but this has to be shown in a scientific manner to have that address that issue. So the key questions for us really is, I mean, it's one thing to discuss all that methodological parts and VLA-max and the lactic time and the time frame and which exercise test. So it's nice. But in my opinion, if we would not name it Vila Max or Vila Peak or whatever we would do it, we just have a look at the maximum blood lactate accumulation. The question is, how persistent is it when you measure in February, or in April, or in July, or in December, for example? Is there a guy switching from 8 millimole to 4? Is it possible? Is it possible that somebody comes from 4 millimoles or 5 to 12? For sure not. So it's a differentiating parameter which is pretty stable, and I'll show you one slide later for that. So, and the next thing would be how can the Vila Max be changed in the natural training process? For example, in rowing, for example, it's very difficult. I mean, they train all the day. They have a high number of contractions during the normal training process. And I'll show you later maybe one slide where we can see from a molecular pattern that in that time you activate the oxidative capacity or the oxidative system. You decrease automatically the glycolytic system. So it's the case that if you do much more endurance exercise than any other persons, it's very critical, or maybe it's normal that it is accompanied by a reduction in the glycolytic capacity. So this is definitely something we have to pursue and have to have a look in. We have to clearly store and save every training data we can get to see when we have a long time frame of lactate measurements, for example, Vila Max determination, where does the change come from and how high is the change? So the next thing would be which training strategies are important to change Vila Max. Can it be increased or can it only be decreased? This is a thing we really have to work on. So, and this is one of my last slides for today. This shows you the variation of Vila Max in elite German rowers between 2023 and 2024. We see, although we can fade away our methodological issues because all these tests here were made very, very consistently with a good methodology and with a nice controlling of the nutritional aspects, for example, but we see some changes. We see that some people with athletes with a low Vila Max will not change between the training periods from low to high, or also not from high to low. So it's pretty stable. But there are some things that are a little bit strange because we have here a huge drop from 0.65 to 0.5, which is maybe something significant, which is very stable, especially when you determine this, when you determine it 4 times in a row. And this year, this guy here was going up significantly, has done something. If it was resistance training or he was ill or didn't train at all. And these things are very important to consider when we have a timeline, so that we can clearly see what's going on. Where does this behavior come from? Is it a methodological or measurement error, or has there something happened with training, for example? So this is something we always have to consider. Okay, I hop over that and I show you one of my last slides, if I have time for that. This is a study approach. We currently do that at the University of Hildesheim, a basic screening of different athletes, so very well-trained cyclists, very well-trained triathletes, and also some sports students to get a high bandwidth of VLA max and VO2 max. And what we do is we test VO2 max, we test the anaerobic threshold, lactate curves, we test a time trial with around 6 millimoles, so a step above the anaerobic threshold, and we test also the VLA max. And what we can see here is that what we all know, what is relevant for anaerobic threshold. So there's a very nice correlation between the VO2 max and the anaerobic threshold. So basically, the higher the oxygen uptake, the higher the anaerobic threshold. So this is not nuclear physics. We all know that. And if we look at a correlation between VLA max and the anaerobic threshold, we see nothing. So obviously, the VLA max of the athletes here, we have tested here, has no correlation, produces no correlation to the anaerobic threshold. So this is is hard for us because we assume that this that VLMX is obviously very important. But if we look here at the time trial at a speed where they produced a lactate curve of around 6 millimoles, so way higher than the anaerobic threshold, we see here that also VO2 max is not correlating with the running time at 6 millimoles, so above threshold. So this is a weak correlation, and importantly, VLMX correlates here a bit better. I know that it is not a nice correlation, and it's not a strict relationship, but the thing is, VLMX here is a little bit higher, shows a higher correlation than the VO2 max for this parameter running above the threshold with around 6 millimoles or higher. So maybe the VLMX gets much more important than when we look at values above the anaerobic threshold. So this is something we are doing currently. We hope to get much more athletes with that. I'm also happy to work with you together on that. If somebody is interested, maybe we can stick our heads together and work on that issue. So, and with that, I would have much more to say also from the molecular part, but I think we're running out of time. And so I'd like to stop my presentation here and thank you for your audience and listening to me.
Excellent. Thank you very much for that. That's been really, really interesting. I've not actually seen any longitudinal data from VLA-max, so it's actually really nice to see what that looks like. Seems like, as you mentioned, it's very hard to actually train it and see maybe big reflections, but it'd be interesting to know what actually did happen with those two athletes over that time. That obviously to see that large increase and large decrease in VLA-max, as we know that relatively small changes could mean fairly large differences within the VLA-max. So we've got a couple of questions in the chat, and I've got one for myself then. So going back to the bar chart that you presented with loads of different people's data on it, I see that there's quite a large difference between, say, 0.19 millimoles and all the way up to 0.75. What do you think are the differences between these athletes? Was there many performance metric differences? I know you both said that obviously they were elite, but why do we think there's such a difference in these athletes? Do we think it's just purely muscle fiber typology, or is there another difference? Because you can see that there's almost a threefold difference between both of the athletes.
Yes. That's a very good question. I have not all of the data here. I know that the VO2 max, so all of these athletes were elite rowers. So there's no one there with a low VO2 max, for example. He would not be there. I think one critical part is the muscle mass, which is different between these athletes. So we have not seen in the bar chart here the body weight of the athletes. They were all distributed at different boat classes, for example. And so this is definitely a thing that differs between these athletes. And the muscle fiber type, we have also no information about that because we cannot do muscle biopsies. And in order to do that, we have to do several biopsies in different muscle groups, for example. So this is just a hypothesis that this might be a thing that is important for that. To be honest, I mean, all the other things with lactate release from muscle to occur in blood might be affected also by monocarboxylat transporters, but I do not believe really that these differences are so high that they differentiate between 0.2 millimoles and 0.7, for example. So I do not really know what it is. It's, I mean, if we assume, okay, that lactate is coming out of the muscle, somebody produces it, this would be the enzymes in the muscle fibers. So the active recruitment of fibers and the production itself would be the most determinant, the critical determinant, I would believe. Yeah.
So along that point, then, I think I think it's really interesting to know the differences between obviously that muscle mass. I'd assume that the muscle mass between when you're looking at the differences between your runners and rowers, I assume the muscle mass obviously in sprint runners is obviously going to be fairly similar to that of rowers. Why do you think there's again a threefold difference between the different sports? Is it just because maybe the rowing uses more upper body, or is there something else that we should potentially be looking at as well?
Yeah, the most important thing is, I mean, it's the number of contractions you can do in a sprinting with your legs, for example, and if you're sitting in a boat on an ergometer rowing, for example. So you have these inertia in the beginning of the rowing process, and the number of contractions you can maximally do in the boat or in the ergometer is sufficiently lower or significantly lower than in the sprinting process. So the contraction itself is not comparable because it's concentric eccentric to a significant amount very rapidly. And I think the accumulation of ADP and AMP is also rising much quicker, possibly activating glycolysis to a higher extent. But I think this is only speculation. It might be obvious, and it might be also obvious that people that are in the third row of the German sprinting elite, for example, are only there because they have this natural ability to produce lactate and to sprint fast. So I'm pretty confident that we see here a biological determinant, which is very critical for the athlete competing in such a sport. So many things culminate here, very likely. But I think the most important thing is that these sprinters, if you look at the power performance they can do in the gym, for example, and if you see the explosiveness they can create during jumps, for example, it's a different neuromuscular thing, for example. Yeah, I'm pretty sure that a high amount of fibers, of fast fibers, are abundant in these athletes, much more than in rowers, which have a very high number of contractions every week when they do their kilometers of rowing, and this is always stimulating the oxidative metabolism. And of course, this will downregulate. It increases the molecular regulators of oxidative enzymes, and it decreases then sufficiently likely, very likely, I cannot say that for sure, the glycolytic enzyme expression.
Excellent. Interesting. Really interesting. So we've got one more question. I think Chris Harnish has one in the chat. So do we have the correlation between weight, body mass, and VLA max? Or do we know this could be not just yourself, maybe the wider audience if you don't have it to hand, but I think that's an interesting point as well.
Yeah, definitely. What we do in this study, we are currently trying to get more samples, is we determine also the amount of muscle mass and try to correlate it also with these athletes. The first aspect is that we want to have a very broad number of participants with different VLA max values and VO2 max values, and then post hoc we try to do further analysis to see what are the differences. Of course, we do the body mass and muscle mass determination, but yet we have not done any correlation. So they all between 60 and 85, pretty high range. And I think that if we have much more of these, that something interesting is coming out. But once again, if you look at the slide from the boxers, you see that the female and the male, if you see them standing next to each other, you see that there's a huge difference in the muscle mass, for example. And this does not, I mean, of course, it will correlate if you have athletes with a similar VO2 max, differentiating or differing in muscle mass considerably. For example, some athletes with 50 kilogram and one with 80 kilogram, that there's a huge more mass which can produce lactate. But the thing is, the more muscle mass you also have more oxidative enzymes and mitochondria in that. So that changes considerably. And the thing is, it is, in our case, nearly impossible to get an athlete with a VLA-max of 1.4 and having oxygen uptake of 75. Then he would be wait for NICAG, for example. Maybe he can do that, for example, with a 400-meter world record. But most people are hanging in the big bunch in the middle between 0.5 VLA-max and 0.6. And they have a big variation between in the VO2 max value. So everything is related to each other, and it makes it difficult to get a clear picture of what's going on there.
Yeah, that's really interesting. So we've got one more then from Henning. So normally hypoxic stimulates the expression of a glycolytic enzymes. Has anybody measured the effect of altitude training on VLA max or VLA peak?
Today, this is a very good question. I personally think this is one of the tools we should use for enhancing the glycolytic capacity, because there's no such paper showing that if you go in a high altitude that you increase your oxidative metabolism. So there's no such study. If you go only in hypoxia, you decrease oxidative capacity. If you train in hypoxia, you can increase oxidative capacity, but it's the training which increases the oxidative capacity, the contraction per se. But I think that hypoxic training, and it is conducted also in boxers in Great Britain, for example. I know they do that. They train in high